A new report reveals only 25% of sunscreens in the U.S. are both safe and effective.
Yeah, researchers found that many fail to block harmful UV rays or contain chemicals that can be absorbed into your bloodstream, and that poses potential health risks. So to help make sure that we all pick the safest, most effective sunscreens to buy, we brought in some help this morning. Joining us today is Dr. Pearl, a board-certified dermatologist. Thanks for being here with us here. We got two different types of sunscreens here on the table, but also just in general, people are perhaps going to buy that. We have chemical and we have mineral. So what's the difference, and is one, I guess, preferred over the other?
Yeah, so the difference between the chemical and the mineral sunscreen is that the chemical actually get absorbed into our skin and actually can be found in our bloodstream. Mineral sunscreen is a physical blocker, so they sit on our skin, and usually we prefer the physical sunscreen, which is the mineral, more than the chemical.
You mentioned the potential of chemicals being absorbed into our bloodstream. Are there bloodstream? Are there any other concerns when it comes to chemical sunscreens?
Yes, it's actually been banned in some states, like Hawaii, because it destroys the ecosystem, like the coral reef and stuff like that. Yeah.
So when people are out there trying to, buy the sunscreens, again, we're getting the warmer months, pools are open here. So what should consumers look for when they go to purchase these things?
Yeah, so they should not. They should look for mineral sunscreen that not only say like mineral sunscreen, like the Eastern, but they also should look for the active ingredients. The two active ingredients for mineral sunscreen are zinc oxide and titanium dioxide. So that's what they should look for, and also being a water resistance would be good as well.
A lot of these, of course, you're squeezing it out of the tube, you're rubbing it on your skin, but a lot of people use spray-on just because
it's more convenient.
It's more convenient a lot of the times.
Yes.
Is there any concern when it comes to the spray-on sunscreens?
Yeah, so spray-on sunscreen, a lot of them are chemical and they're not mineral, so there's a possibility that you can inhale them and cause some damage to your lungs. Also, the coverage, because you're spraying it, if the wind happened to, if it's happened to be windy that day, you might not get the entire, coverage.
Yeah, your neighbor next to you might get the coverage instead of the intended target. But, you have a lot of different sunscreens at the table here. But there's also a wide price range from your, Hollywood designer sunscreen to your Acme store brand. So is there a big difference between the price point in terms of what you get in that bottle?
So I always tell people the best sunscreen are the one that you actually put on their skin. Usually the higher SPF, like SPF 100, are more expensive than, SPF 50. But between SPF 50 and SPF 100, most people don't know is that there's only 1% difference in the UV blocking ability.
Between 20 and 100?
Between 50 and 100, yeah.
Wow.
There's only 1%. So you can use SPF 50 and still be very effective.
Wow. So there's obviously all different types of sunscreen, but there's a newer one that I've actually never even heard of. It's edible sunscreen, whether it be pills or gummies. They're growing in popularity, but do they actually work?
So we recommend them as a supplement. You can do them as a supplement, like, eating antioxidant-rich foods like the berries, vitamin C, or taking HelioCare, which are to reduce the risk of sunburn. But it should never replace your sunscreen. Yeah.
And also, sunscreen is something that every person, if you have skin, you should use it depending on, regardless of what shade of skin you have.
Yes, that is true. So the myth is that if we have a darker melanin, then we don't need to use sunscreen. But it's not true. We said, there's a lot of sunscreen out there now that are tinted and usually blend very well.
I have to ask the myth about the base tan. A lot of people say, like, I've got the base tan. I'm talking to my husband right now. We had a back and forth about this a couple of days ago, and I've got a base tan. I'm okay. I don't need as much sunscreen.
Yeah, so I have a lot of my patients would say that, like, I've been using a tanning bed, which is bad, to get a base tan, which is not true. Base tan just make you have a little bit more melanin, but you still need to use sunscreen always.
Now let's talk about the basics. SPF, what is it, and what should be perhaps the boilerplate, the ceiling, or I should say the floor of what should be the minimum SPF you should be using as you go out to the sun?
So we always said SPF 30 should be the minimum, but if you do have history of skin cancer like melanoma, at least SPF 50.
What about reapplication? So, you put the sunscreen on, you're good to go, you jump in the pool. How long before you need to put that next layer of sunscreen on?
Yes, so every 2 to 3 hours. Yes, which a lot of my patients seem to be surprised to Yeah, so we said every 2 to 3 hours.
And what about the little ones too? Because I've got a 2-year-old, and I always wonder, okay, we put on, you know, it's always difficult to put on the sunscreen. It's a whole event. How often is it different for the little ones for reapplication?
So it's the same. It's still every 2 to 3 hours. A lot of time parents will use the spray for the little one, but I find that maybe the stick one is also as convenient.
So we know we got the sunscreen here, but there's other ways to protect yourself, perhaps physically, like perhaps an umbrella or maybe even clothing. Does that work too?
Yes. So an umbrella, a wide brim hat, sunglasses, and UV protective clothing. And also being outside early in the morning or late afternoon, try to avoid the sun between 11 to 3.
When it comes to the protective clothing, because I've recently gotten into that, you know, obviously I have fair skin, so I burn very easily. Do you have to put on sunscreen and then the clothing?
Yes, a lot of times we still recommend sunscreen and then the UV protective clothing.
All right, Dr. Pearl, great information. Thank you for being with us here today, right here at the beginning of summer. Important stuff.
Let's go to the beach.